After nearly a month of behind-the-scenes talks, Maryland managed to secure 500,000 coronavirus test kits from South Korea, thanks largely to the state's first lady, who is a Korean immigrant. But President Trump has been criticizing that move, saying that Governor Larry Hogan didn't understand his state's testing capacity. The governor joins us this morning on that. Governor, good morning. Thanks so much for being here. We know that you have been part of this coordinated effort, not only in your state, but at the national level to ramp up testing. So what are these extraordinary measures that you and the First Lady of your state have taken to increase testing?
Well, so the president has said that the states really are on the front lines and need to go out there and get this testing done. That's exactly what we've tried to do. We have been working very hard, as have been the other governors around the country, to try to get testing from domestic companies all around America, but also from around the globe. We were very successful after more than 3 weeks of negotiations to get the assistance of South Korea and a couple of South Korean companies to get these tests delivered to our state. It's a tremendous accomplishment. We now have more testing capability here in Maryland than the top 4 states in America have done all the way from the beginning of this crisis added together. So it's going to help us get to the point where we can reopen our state and get people back to work. Having the adequate testing has been a huge part of the trying to get things back to normal. And we're so thankful and appreciative that we finally got it done. And my wife and a great team of people here in the state of Maryland, along with some great partners in Korea, got this thing done for our state.
So then those test kits were then flown in on a Korean Air jetliner. You and your wife were on the tarmac to receive those test kits as they came in. I believe that was Saturday. Heading into that, you said the #1 problem for your state is lack of testing. And you said, quote, it shouldn't have been this difficult. That was seen as criticism on the federal government, the White House, and the president. President Trump reacted to that in his briefing yesterday. Listen.
Governor Hogan, he didn't really know. It was very obvious to any of those listening on the call today, even though you weren't supposed to be on it. I'm sure that some of you were, or representatives were. He really didn't know about the federal laboratories. We've done a really good job in testing.
Up till then, you have been working very closely with the president on this. What was your response to the president, and what was it that he's suggesting you didn't understand?
I'm really not sure, Sandra. It was a great call we had yesterday with the vice president. I thanked and praised the vice president and the president's team for all the progress that they had been making. I thanked them for what they were doing with respect to swabs and ramping up testing and PPE. It was a completely positive call. They put out a list of the labs that are in our state and said, these are your state labs. You should be utilizing them. We already knew where the state labs were in our state, but the list that they gave us was mostly federal labs, which we've been attempting to use for more than a month now. So we got a commitment yesterday from the vice president and from the president that we can now use federal labs, which is terrific. But the president was not on the call, and somehow I think he got confused in the press conference. I'm really not sure what he was upset about. We did what he told us to do, which was go out and get our testing, and we had a great call with his entire team yesterday, and I was leading the call on behalf of all the governors.
Did you reach out to him after he said that?
No, I haven't, but I know he's meeting with Governor Cuomo today, who's my vice chairman of the NGA, and hopefully we'll get a chance to talk. Or maybe I'll talk with I think the vice president corrected him yesterday in a press conference. But I mean, it was a great call. I don't think he was on the call, didn't understand what the discussion was about, but I have no idea what he was upset about.
I'll finish by asking you the biggest question is, when can you reopen up your state? You said we can't open up our states without ramping up testing. You have now secured these 500,000 test kits for your state. What does that mean about you reopening Maryland? Can you do it?
So the president's plan, which he announced last Thursday night, calls for before he suggests that you can open up any state, you have to have 14 days of downward trends of numbers. Sadly, in our region, because of all the distancing we put in place, we were one of the first, most aggressive, earliest acting states. Our numbers are behind everybody else. We've flattened the curve. We've lengthened the curve. But now we're starting to go up. So we're now 25,000 cases today in the region, over 1,000 deaths. And so under the president's own plan, we can't open yet. But we've been working on a reopening plan for several weeks now. I'm going to be announcing that later this week, and I'm anxious to get us open as soon as we possibly can do it in a safe way.
I know yesterday you made an announcement that you would be opening back up salons and barber shops for some of those essential workers that so badly need that assistance. Governor, we really appreciate you coming on this morning. Please keep us updated on the progress in your state. Thank you.
Thank you, Sandra.
All right. Meanwhile, Texas now beginning